Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Kristen Carosa. It's been a long, tough winter, and people are going to start to head outside for some spring sports, but do so cautiously.
After the winter that we've had, activity should be ramped up gradually if you're not participating in a winter sport. Starting with general conditioning, getting good cardio workup, running, jogging. And then each session should also start gradually. 5-minute warm-up, walking, light jogging, followed by stretching, and more stretching. Things that I commonly see in younger children are fractures, the upper extremity, wrist fractures, forearm fractures, elbow fractures, and to a lesser degree, ankle injuries. The difference between the children and the adults and teens is that often they're incomplete fractures or fractures through the growth plate. These all usually happen by a fall onto an outstretched hand or with the ankle, a twisting injury. The important thing for parents to realize is they can happen with any activity, and that proper knowledge of the sport, good playing field conditions, and many of these happen on playgrounds as well, a good surface that are very important to prevent these.
If a sports injury should happen, there are some warning signs when it's time to seek attention.
One thing that parents often want to know is, when is it serious enough to go to the emergency room? Of course, if you see deformity or the child doesn't want to walk on it, those are automatics. Others are, if the pain is persistent, it's always safer to have an x-ray.
Now, there are some injuries that are more commonly found in adolescents that teens need to be aware of.
Injuries to the knees and the ligaments of the ankle, often found in older children, adolescents, and teens. These are often non-contact injuries, twisting injuries, jumping and landing. There are several steps that we can take to help prevent these. There are several ACL prevention programs, and if a child or their parents are concerned about these, they should ask their coach or trainer about them. They focus on two things. One is the mechanics of landing, so that they're not twisting their knees and ankles. The other is building up the secondary stabilizers of the knee, mostly the quad muscles, the thigh muscles. The other component of this is the oversight by the coaches and teachers, knowing the signs and symptoms of an ACL tear. Large amounts of swelling, feelings of instability, and inability to bear weight at that time are indications that it should be looked into further.
And when it comes to specializing in sports, overuse can cause injury.
We see this oftentimes in throwing athletes, injuries of the shoulder and the elbow. We have injuries of the shoulder, traction apophysitis, also in the elbow, and as the kids get older, ligamentous injuries such as ulnar collateral elbow injuries. These often will come on over time, and children are often afraid to come forward with these because they think that they should tough it out. If there are continuous complaints about these, then they should be investigated.
As a parent, there are some warning signs to look out for that your child's injury could be serious.
In the throwing athlete, it's often a loss of control or velocity, especially with the pitchers. Pitchers aren't the only ones who get these. Some of the field players and catchers also do. Players in other sports get overuse injuries as well. Jumping sports, anterior knee pain is very, very common. Conditions such as Osgood-Schlatters disease, which is traction injury to the proximal tibia, and patellofemoral pain syndrome can result from these. Other injuries that we see in dancers, runners, we often see stress fractures of the tibia and also the feet. This is also persistent pain that just doesn't go away.
When treating a sports injury, there's something you should think about doing right away.
After a minor injury, even overuse type scenario, ice is the recommendation over heat in the first 24 to 48 hours. If ice and rest for a day does not relieve the pain, then that should be looked into further.
When it comes to sports and playing outside, the message from doctors is simple.
The big message for children is, yes, moderation, have fun, but your sports shouldn't hurt.